Gout is a type of arthritis that causes intense pain, swelling and stiffness of joint. Gout is caused by an increase in uric acid production under excretion of uric acid by the kidneys or increased intake of food containing purine which are metabolized to uric acid by the body. Characteristic deposit of sodium urate crystals occurs in articular, periarticular and subcutaneous tissue. Gout may be classified as primary or secondary. In primary gout, a hereditary error of purine metabolism leads to overproduction or retention of uric acid. In secondary gout, that may related to another acquired disorder or may be the result of drugs known to inhibit uric acid secretion or uric acid excretion. The main etiology of gout include high purine food, alcohol, genetics, chronic kidney disease, diabetes, acidosis or ketosis, atherosclerosis, chemotherapeutic drugs, drug-induced renal impairment, hyperlipidemia, hypertension, malignant disease or cancers, myeloproliferative disorders, obesity or starvation, sickle cell anemia, use of certain common drugs like aspirin, diuretics, etc. So all these may cause hyperuricemia and gout. Pathophysiology of gout. Uric acid is the major end product of purine metabolism and it is primarily excreted by the kidney. Hyperuricemia may be the result of increased purine synthesis, decreased renal excretion or both. High dietary intake has a little role in increased uric acid level. Hyperuricemia may result from prolonged fasting or excessive alcohol drinking. So, the etiological factors that leads to the impairment in purine metabolism that leads to increased uric acid level. If there is increased production of uric acid, that leads to hyperuricemia, and if the kidney is not excreted well, that also leads to hyperuricemia. This hyperuricemia affects the kidney, soft tissue of joints and other tissues such as ear. So, when the hyperuricemia occurs, that will leads to a signs and symptoms such as pain, swelling and stiffness of joints and accumulation of urate crystals in the area. So, this is the pathophysiology. The clinical features of gout, it includes joint swelling, heat in the affected area, sudden onset of joint pain and joint redness. The symptoms, it's divided into acute symptoms and the chronic symptoms. In the acute phase, the gouty arthritis may occur in one or more joints but usually less than 4. Affected joints may appear dusky or cyanotic. Usually, the symptoms will be starts with podagra, that is inflammation of the great toe, that is the most common initial problems, and the mid-tarsal area of the foot, ankle, knee, wrist also can be affected. The symptoms typically occurs at night with sudden swelling and excruciating pain peaking within several hours, often accompanied by low-grade fever. Individual attacks usually subside treated or untreated within 2 to 10 days. Then the affected joints will be returned to normal. But in case of chronic gout, it is characterized by multiple joint involvement and visible deposits of sodium urate crystals called tophi. These are typically noted in synovium, subchondral bone, olecranon bursa and vertebra along tendons, and in the skin and cartilage. Chronic inflammation may result in joint deformity and cartilage destruction may predispose to joint to secondary to osteoarthritis. The stages of gout progression. The stage 1, high uric acid level or hyperuricemia. Here the uric acid level will be increased in the blood and also it may be accumulated in the joint. In stage 2, acute gout, the person will exhibit the signs and symptoms of gout and painful joint and swelling will be there. Then in stage 3, that is intercritical gout. Here the period of remission between gout attack will be occurs. Then stage 4, that is the chronic gout. Gout pain is frequent and toffee form in joints. So in stage 4 only the toffee will be occurs. So this is the stages of gout progression. The diagnosis of gout, it includes history and physical examination, family history of gout, presence of sodium urate crystals in synovial fluid or joint fluid analysis, then serum uric acid test, then elevated 24-hour urine for uric acid levels, then complete blood count, ESR test, C-reactive protein test and imaging test, X-ray, synovial biopsy, etc. The management of gout, it includes collaborative therapy, joint immobilization, local application of heat or cold, joint aspiration and intra-articular corticosteroids. Then drug therapy include non-steroidal anti-inflammatory drugs, naproxone that will helps in acute attack, then steroids, especially prednisolone. Intra-articular prednisolone injections can be given in acute attack that will be helpful to reduce pain and inflammatory response. Then allopurinol. Allopurinol is the first line of drug that is used in gout. It is xanthine oxidase inhibitor and start at less than or equal to 100 mg daily. And next drug is febuxostat, xanthine oxidase inhibitors. It starts at less than or equal to 40 mg daily. It is not a common drug here. The next one, probenecid. It's a common and second drug that is used for gout. It is a uricosuric agent. Starts at 100 mg once or twice daily and it can be increased to 1 gram twice daily. Then next drug is pegloticase or that is uricase drug, 8 mg intravenously for every 2 weeks. Then another drug is colchicine. Then another drug we are used is adrenocorticotropic hormone or ACTH. So ACTH that will be helpful for treating gout. Then dietary modifications, like we have to avoid some food such as that contain high purine, for example red meat, then liver, then wine, beer, etc. Then avoid alcohol. Then adequate urine volume within normal renal function must be maintained to prevent precipitation of uric acid in the renal tubule. And the drugs that cause like aspirin that have to be withheld, otherwise may increase risk of hyperuricemia. The food have to be avoided during the time of gout, that is red meat and seafood, alcohol and beer, sugary drinks and added sugar of all kinds have to be avoided.